Everyone had a good break. There will be a lunch immediately after this panel, so don't worry if you didn't get any food or time to walk around outside. It's just this, and then it's lunch. Okay. So the panel I'll start with introducing myself. My name is Ivana Iwasaki. I'm an associate lawyer at Yelenis Ellis Gluckstein Lawyers. I've worked with Simona since 2021, and I have had the privilege and pleasure of working exclusively with survivors of sexual abuse, childhood sexual violence, and to a small extent, survivors who are being countersued for defamation as well in my practice, and it's been my joy to help them navigate the system. My clerk and I have a motto we like to use, which is, they suck and we're going to make them pay. And I think that encapsulates pretty well what we do every day. So it's now my privilege to welcome an inspiring group of panelists who do on-the-ground work with survivors every day. And today we're going to have a discussion about the resources that are available for survivors, especially survivors of sexual violence. These leaders and advocates have dedicated their lives to supporting survivors and driving meaningful change in our communities, bringing a wealth of experience to this critical work. So please join me in welcoming our four panelists. So Lyndsey Butcher, who is the MSW and Director of Services at the Sexual Assault Support Center of Waterloo Region. Lyndsey. Next we have Grissel Orellana, Program Director of the Latinx Women Program at the Toronto Rape Crisis Center, Multicultural Women Against Rape. Thank you, Grissel. Joining us as well is Tamar Witelson, Director of Legal Services at the Barbra Schlifer Commemorative Clinic. And last but not least, Dr. Cindy McMann, who is the public educator with the Guelph-Wellington Women in Crisis Center. Thank you, everyone, for joining us today. So I've briefly described your roles and titles and the places you work, but we haven't gotten into what your places of work do or what your personal jobs are. So let's start by having you introduce yourselves and then talk about the service center where you work and some of the resources that you have there.
Thanks, Ivana. Is this on?
Yeah, it is, yes.
Okay. So good morning, everyone. My name is Lyndsey Butcher. My pronouns are she and her. I work as the Director of Care at the Sexual Assault Support Center in Waterloo Region. And our center is probably one of the largest SACs in Ontario, if not in the country. We have several programs. We have, of course, our 24-hour support line. We do counseling. We have a special sexual violence legal advocacy program. We do family court support and support groups. And we have a specialized anti-human trafficking program. We also do quite a bit in prevention education. And so we have a program for male allyship. We work with a number of athletic organizations to try to prevent gender-based violence. We also have an anti-human trafficking prevention program as well. I joined the sector back in my undergrad. I was a support line volunteer in my early 20s and have been committed to feminist work my entire career.
Thank you. Thank you for the invitation, everybody. My name is Grissel Orellana. My pronouns are she and they pronounce. I'm from the Toronto Rape Crisis Center, Multicultural Women Against Rape. The center has been around for 51 years. It began by providing a crisis line to survivors during a time where the advocacy for collective work in violence against women movement began over 50 years ago. And during those difficult times, then the crisis line was born. Through other services, we have one-on-one counseling, support groups, court support accompaniment, where we support survivors in that process. We don't provide legal advice. What we do is that we refer them to legal clinics or support in terms of lawyers that can best define how the system will be able to provide that guidance. As we know, the legal system does not represent the survivors in many ways in the legal system, so that is always a challenge. Because we are multicultural, we focus our accessible services to Black, Indigenous folks, people of color, and also being linguistic accessible. Barbra Schlifer Clinic is a great partner in our community who can provide the linguistic access to folks. As we know, we do have high numbers of refugees that we work with as well, coming from very difficult situations across. And we do activism as well, Take Back the Night. and try to be as active as possible to provide our services free and confidential. Our crisis is 24/7, and our services are Monday to Friday, 9 to 5. Thank you.
Hi, everyone. My name is Tamar Witelson. I'm the Director of Legal Services at the Barbra Schlifer Clinic. Pleasure to be here and on this panel. So the Schlifer Clinic, we just celebrated our 40th anniversary, and we're based in Toronto, but we do have a reach through Ontario, and some of our projects, in fact, have an international, a national component, and we also participate in some international work. What we provide is what we call wraparound services for survivors of gender-based violence. So that includes both women identifying and gender diverse clients. So those services may involve one or several of the following. We provide counseling services, one-on-one and some brief counseling as well as group counseling. We provide interpretation services in more than 200 languages, recognizing that many survivors speak more than one language and are more comfortable, even if they have facility in English, are more comfortable talking about their experiences of violence in a language that is either their first language or another language. And then we also have a legal department, and so that's the department where I work. And to give you a sense of the kinds of services we provide that are legal, we focus on family law, immigration law, and independent legal advice for survivors of sexual assault. And as you might imagine, often issues in an individual's life will intersect across 2 or 3 of those areas of law. And with respect to survivors of sexual assault, we provide, as I say, advice, independent legal advice. We do not provide representation. And we've been doing this work since 2017, when there was initiative in the Ontario province through a former government to focus on sexual violence and harassment. And so this program was developed both within the clinic and in a program run by the Ministry of the Attorney General around, well, first 3 locations in Ontario and eventually across the province, to provide information to survivors if they want, and we really encourage them to talk to a lawyer before they initiate any kind of a legal process, to understand what the options are, to have a chance to ask questions, get a sense of what to expect, and make an informed choice, even if that is to not pursue any option. We're also available to provide advice anywhere through that process. And that province-wide program was delivered through a roster of private bar lawyers who were paid up to 4 hours through a voucher for free advice. And in April, just a few months ago, the Ministry of the Attorney General decided to give that program to the Schlifer Clinic to run side by side our other programs, and to integrate the work that we do with all survivors at first contact, to do a risk assessment, to do safety planning if it's appropriate. And so now we've expanded this service so that we work with private bar lawyers, we administer the vouchers, and just to give you a sense, we provide advice either internally or through those lawyers on all areas that might be relevant to a survivor of sexual assault. So criminal is obviously the usual question, or the first question we get, but we also can talk generally about the civil process that we've heard about today, human rights complaints, disciplinary complaints, and help survivors get that preliminary idea of what it is to engage in these processes, what it might take, even if they are preparing to make a report to the police, and And as Grissel said, we often work with TRCC to support those clients. So just very quickly, because I know I'm taking up a lot of air, but other legal services that we provide at the clinic, we have a program to support women who have been criminalized as a result of an abusive relationship and they themselves have been charged. And so we assist them in advocating with the Crown up front to try to explain the context and hopefully either reduce or have the charges withdrawn. We also have a program called And Me Too, which focuses on sexual harassment in the workplace. So I hope at the end of the discussion today, you'll remember us and you'll refer clients to get some information from the Schlifer Clinic, and we will do our best to work with them and refer them out as appropriate. Thank you.
Hello, it's so nice to meet you all. My name is Cindy McMann. My pronouns are she and her, and I am a public educator with Guelph-Wellington Women in Crisis. So I can tell you a little bit about the organization that I work for. We serve Guelph and Wellington County, and we support people who experience gender-based violence. We started out as a rape crisis line, which was staffed by some volunteers on the University of Guelph campus, and that was back in 1977. So we have been around for about 48 years doing this work. Guelph is a smaller community, so we are a bit of like a one-stop shop for folks. We run a number of different programs. Most people from the area will know us for our intimate partner violence shelter, Marianne's Place. So we have a 28-bed shelter where folks can come if they are leaving an abusive relationship. Our crisis line is still on the go, a 24-hour crisis line that anybody is free to access. Although folks don't have to, leave an abusive relationship in order to get support from us. We run what we call a transitional and housing support program for folks who are experiencing abuse. We also run what we call a family court support program for folks who are going through the family court process and have experienced violence themselves. We run a sexual assault center as well as an anti-human trafficking program. And we run services out around Wellington County as well. So we have what we call a rural women's support program as well. And again, that can be sort of a bit of a one-stop shop for folks who are in more remote parts of the county. And then we also have our public education program as well. So in terms of like the services that we offer, we are really client-led. So people will come to us and we will ask them what they need, and they will tell us, and then we will try and make that happen. So we offer things like counseling, individual, and also some groups that we run, and then also those practical supports too, right? Because violence impacts every single facet of our lives. The range of things that people need can be pretty extraordinary, and we can kind of work as a bit of a connective tissue to make sure that people are reaching the services that they need and providing, what you'd say like that wraparound support for folks. So then in terms of public education and my role, I will go out and talk to basically whoever will have me about violence. I'm extremely fun at parties. And probably the most relevant things that we talk about in this context is that I will go out and talk to community partners about how to respond to disclosures of sexual violence if they get them from clients. Most folks are pretty nervous about having those conversations, so we can give them some tools and also talk about like maybe some best practices and ways to get folks connected. We do a lot of consent education, like through the schools, with our OHL team, through a program called Onside that SASC was instrumental in developing, and for youth in the community as well, on the university campus. So we run a lot of consent workshops, and we also do a lot of preventative education around human trafficking. So that, again, might look like going out to community partners so that we can talk about maybe like some risk factors, some red flags, how to get clients connected if they need to, and also talking to specifically our grade 7s and our grade 10s around Guelph and Wellington County. We have been doing that kind of education and delivering anti-human trafficking presentations for both of our school boards for the past 3 years. We're pretty proud of that. Our team reached over 11,000 people as of last year, which is a huge number of kids who have just a little bit more information about that. So that's a bit about me.
So before we get on to the next set of questions, thank you very much. And it's incredible to have such wonderful, powerful women helping our community members do such incredible things. Thank you, all of you. So the format for the rest of the panel is I'll ask a couple of questions so we can get some basic information, and then I'll leave time at the end for questions from the audience. So as we're going, if you have any questions, kind of save them to the end, and I'll leave some time for that. So we have a couple of topics I wanted to cover. So the first one is survivors' needs and healing processes. So all of you have talked a little bit about the wonderful variety of programs that you offer, but specifically, what do survivors often say they need most in the immediate aftermath of an assault, and what are things that providers overlook in that kind of immediate aftermath in terms of what survivors need? And I'll start here with Lyndsey, and then I'll start at Grissel next time.
So I think something that's often overlooked is that survivors need time. Often when responding to a crisis, there's a lot of pressure. You need to make a decision right now. We need to go to the hospital. We need to go to the police. There's a lot of pressure on survivors to move quickly. And I think, when we speak to survivors after they've experienced that, they said, I just wish I had more time and someone had really explained to me what my options were, legally especially. And so I think really survivors need someone who will sit with them, who will validate them, who will let them know that what happened to them is not their fault, that they believe them, that is critical. But also someone who's patient, who isn't trying to pressure the survivor in reporting to police or in making any type of decisions until they really have been able to process what's happened, they've been able to have a good night's rest. We know how trauma impacts the memory, so really just being with someone who will meet the survivor where they're at, take their time, and follow the survivor's lead in what they want to do next, and helping them along that path, but not pressuring or saying, okay, so this happened, and so we have to do X, Y, Z, and go, go, go. I know sometimes as service providers, we can get a bit anxious, taking these support line calls, oh, it's just happened, we need to do something. We really just need to be present and supportive and follow the survivor's lead and provide them with as much information as they need to make the decision that's right for them.
Thank you. To add to that, also being mindful of their safety. Our calls that come in through our crisis line is, are you safe right now? Can we talk? How much time do we have? How does it sound to have, about 5 minutes just to express to me what has been happening for you? And setting that grounding space of finding their voice, finding their place of leadership. I'm about to talk about something really serious here, and I don't even know how to begin to have this conversation. So our tone of voice, our calmness, setting that, peacefulness, the safety around the person, and what do you need right now in this moment, just to, the next 5 minutes, or breathing. There's a lot of silence in the moment, a lot of silence, not knowing how to begin. Take your time, breathe. Let's breathe 3 times in this moment. Give me one word that, can come out and just begin an open-ended conversation regarding what's happening for you. And once we hear from the survivor, it just comes with a flow and sets the beginning, how we start this healing journey in that immediate moment of need. And as Lyndsey stated, giving that time and space. In our crisis line, we have 20 minutes. 20 minutes to speak to, because our lines are very busy. And so within those 20 minutes as a counselor, we are trained to sort of figure out what's happening in the first 5 minutes, what's happening in the next 10 minutes. And by the time the 50 minutes come up, the person is like, I feel so much better. I don't have a plan. However, this is your options. Let's take note down. What is available to you? Where are your location of places that you are? Because given that with TRCCs in Toronto, in Greater Toronto area, it's also finding out what community do you reside and what is available to you. If you want to report where the police is, that is an option. If you are at risk and you need to prevent a situation from going farther, to be able to take care of yourself safely. If that is not the decision right now and you're in a safe space where you are okay, then we can move into, counseling, or call us back. But, you define that space and time. Thank you.
So, yes, all of the above. I forgot to mention, but you may already know, so the Schlifer Clinic is not a crisis service, and so unlike some of the other services, here on the panel and in the community, we don't always get that immediate, like right after an incident has happened, call. It's not that it never happens, but so what we try to do when we do get the call is really build that trust, and I can speak certainly for all of the lawyers, and actually we have a court support program in the family courts as well. We really focus on trying to provide trauma-informed service, which means building trust and listening, validating the experience, and hearing when and how the survivor wants our help, has a question, helping to identify the issues that they may want to address right away or sometime down the road, and really taking it at their pace. And I don't think it comes as a surprise to people in this room, but there is such a thing as trauma-informed lawyering, and we really do respect the autonomy and dignity and personal decisions of our clients, and we take their lead.
So I just want to preface by saying that, as a public educator, I myself don't do direct service. So for the direct service questions that we have, I was able to mine the considerable expertise of our counseling and management teams. And so what I will be doing is my absolute level best to represent their insights on these. And so I can just echo what everybody else has said, particularly around people wanting options without pressure. Right, just like a clear sense of like what some options are without anybody really like pushing them to make a choice in that moment. What folks really emphasized on our end is that trauma impacts everybody so very differently, right? And so what people need will be very different. It will be very individual. Everybody's needs are going to be quite unique. But that those needs might be very simple and they might be very physical, right? Maybe somebody needs like a warm blanket or a glass of water or a snack. That might be what somebody needs. Somebody might want just like a listening ear, somebody to just like sit with them without judgment, without blame, and just to hear them out. So people's needs, as I said, will be pretty extraordinary.
Thank you. Excellent. So in the interest of time, I'm going to skip ahead to some of our later questions. One of the questions that we often get, especially with historical claims, is, so I am doing question 2 right now, but then it'll lead into another, or topic 2 right now, for anyone who's on their papers. What challenges do survivors face when they come forward years after? And what strategies can services use to support survivors who come forward years after violence occurred? And I said I would start with Grissel this time, so if we could get Grisel's answer first.
Okay, thank you. The challenges that we have heard from survivors has been not being believed, the judgment. Why didn't you report? Why didn't you say anything? And that is, the wrong way to go about. Many survivors take their time as we begin the conversation. How do I disclose something so intimate that happened in my life that was traumatic? When we're talking about child sexual abuse or sexual violence, it's the most intimate, traumatic experience for somebody's life. And so the challenge is, how do I get through this every day of my life and living my life? Because it may have happened through somebody I know, within the family, work, anywhere. Unfortunately, these incidents happen. And so the challenge becomes, how do I get to express and tell? And how do I get to be believed through the story of telling it? And for folks who've been, 30, 40, 50, elders, speaking about marriages, 40 years marriages, experiencing sexual assault in their marriages. Their children experiencing child sexual abuse, the challenges of that as an elder or as a person who you reached your adulthood, you're like, I'm ready to deal with this. So that's one main thing that we've heard a lot through the survivors, is not being believed.
If I could have Tamar next, we'll just kind of go in a round robin situation.
Sorry, can you remind me the question?
Yeah, so it's, what are some of the barriers or hurdles survivors face coming forward years after, or in the context of historical sexual abuse?
Okay, so first of all, often survivors don't know that there is no time limit to make a report either to the police or to engage a civil process. However, when we're talking to clients who do have historical experiences, part of being trauma-informed is being honest and direct. And so it is true that clearly there are challenges with respect to evidence, whether it's if there might be some supporting evidence and finding those witnesses, finding that evidence. It might be in relation to memory, not only because of the passage of time, but obviously because of the trauma. And so there's no question that there are challenges in succeeding in a legal process. However, some of the things that we do is, we encourage the survivor to think about whether they might want to try to collect some existing evidence or documentation that they could actually take with them to the police, help the police do their work, because often they need the help. And so that might be, for example, CAS records or documents that are held by an institution. It can be a difficult issue about therapy records, so we wouldn't necessarily advise clients to take those to the police, but to collect them, to review them, and quite frankly, we would probably refer them out to a lawyer who practices in criminal law to look at that evidence and give some advice about what to do with those records. However, having said that, it can be a difficult process and sometimes a disappointing conversation. You may be aware that as recently as last month, the Supreme Court of Canada issued a decision in R.V. Shepherd, and it was in relation to an historic abuse of a young boy in school by his teacher. He was age 7, and 28 years had passed, and I'm sure my colleagues in the room will know this better than I, but the Supreme Court, first of all, found that the trial decision's conviction could stand, that the reasons were acceptable even with that passage of time, and dispelled some of the recurring myths specific to, historic survivors, but I can actually apply in cases of adult survivors, and that is, for example, the fact that a person has accessed therapy per se does not raise a legitimate issue about their credibility or reliability. And the fact that they may have been experiencing what was described as a troubled childhood at the time of the alleged incidents doesn't necessarily provide a context for which one might not believe just on that basis. Obviously, credibility and reliability are assessed, with respect to individual witnesses all the time. But so the good news is that people can still be successful in bringing these claims forward after a passage of time and getting a conviction if that's in fact the goal of engaging with a legal process. And at the same time, I think it's sobering because, again, for people in this room, it's kind of encouraging and disheartening that those very basic ideas about, what affects the credibility of a survivor of sexual violence, what those stereotypes are, and that they have to be identified again in order to be dispelled again.
Yeah, so I think what a lot of our clients are sort of bringing is is a lot of really like internalized shame. There's still a ton of stigma around this. So folks are definitely, carrying a lot of self-blame, a lot of doubt, a lot of worry that this was their fault. Rape myths are still, like you said, sort of everywhere, and people can deeply, internalize that. And then I think, there can also be kind of that sense of futility too, right? Like it's too late. Nobody's really going to do anything about this. There's not really a ton of evidence, like what's even going to happen. And then other things that our team has sort of picked up on is that, some folks might come in like really sort of afraid to open the box, right? Like afraid of what will happen. No matter kind of, where they are in their healing journey, they might feel like they're at least in familiar territory, right? And they feel like, they kind of like have a rough handle on things. And if they start to really like dig in and sort of open up those old wounds, then what will happen to them, right? Will they be able to like put the box back together again after? There's also, I think, like an extra layer of scrutiny that people face, right? Coming forward years after. I mean, we tend to be, blamed for speaking up about sexual violence if we speak up, but we're also blamed if we stay quiet, right? And there's that extra level of scrutiny around like, well, if this had been serious, you would have said something at the time, right? Or why didn't you bring this up earlier, right? So there are those extra levels too. And then in terms of strategies that services can use to support survivors who disclose historical things, I want to pick up on what you had said about records, because that's one thing that our team's really flagged is that trying to provide evidence and get records from services is something that's really challenging. So if people have to go back and get medical records, if they have to go back and get records from like a CAS or Family and Children's Services of some kind, if they have to request police reports, like those things really take time, and they are really difficult. It's pretty labor intensive, and people often have to do a lot of legwork to get them. So anything that those services could do to try and make that process a little bit more efficient, and to also just like have fewer hoops that people need to jump through, that would probably be super helpful for people.
Thank you. Okay. So I'm going to skip basically right to the end, so topic 6 for those following along. So we're going to start with what supports or services such as housing, employment, therapy, peer support, family supports have you seen make the biggest difference in survivors' lives? So I am going to, since we're doing a round robin, I'm going to start with Tamar this time and then go to Cindy and then come back. So to repeat the question, it's what sort of resources and supports have you seen survivors benefit from the most in their healing process and continue on towards thriving?
Perhaps contrary to what you expect, I'm not going to say the legal process.
I don't think anyone is surprised about that, actually.
But from the mouth of a lawyer.
Ditto.
I mean, I find it hard to answer this question because, of course, it really is so individual. And I think it needs to be that holistic approach, that wraparound series of supports, and in fact, collaboration as much as possible. So, for example, even though at the clinic, we do have some counseling services, we have interpretation services, we have a variety of legal programs, and we can consult and support one another internally, even with respect to a single client, obviously with consent. But we regularly work with other service agencies and with housing supports, with counseling outside and community organizations that support individuals in terms of their community, and with outside lawyers. And so I think depending on the needs of the client and the complexity of the case and the level of barriers that they are dealing with in terms of reaching the outcome that they are aiming towards, I think, I think the most important thing is to bring as many resources as possible, to share the resources that we have across strapped organizations, and to learn from one another and take the client's lead.
Thanks. Yeah, so The answer that I got from folks about what supports and services have made the biggest difference was like all of them, like all of them that would make a really big difference. But particularly like starting out with those like filling basic needs, right, that lend people a sense of safety, right? It's going to be difficult for somebody to work on their trauma if they are really food insecure and they haven't eaten in 2 days. If they are housing insecure, it's going to be more difficult for them to feel safe. If they are working with an undiagnosed brain injury, that's going to make things more difficult. So making sure that all those basic needs are met first, that can really go a long way towards then allowing people to sort of do that sort of deeper work. One thing that was flagged by our manager was that there used to be a thing called the Victim Compensation Board that she found very helpful. So RIP, the Victim Compensation Board, it sounds rad, because what it used to do apparently was award people like quite a substantial amount of money. Like she was talking like 100K, like over 100K, for people to be able to just like take time and heal. So you could take like a year off and you could do that work like full time of just like healing and getting yourself back together. Whereas now, like people are really having to sort of do this work kind of, off the side of their desk, more or less, right? And doing this as time permits and also, of course, as the budget permits too.
It was rad. It was. So our office would sometimes assist with making those applications, and just getting even therapy funding could make a huge, huge difference. So definitely RIP to the CICB.
One thing that I've seen that has been like transformational in the lives of survivors is being engaged in advocacy, in communal healing, being in support groups. I know there's a number of survivors joining us today who are part of Survivors for Justice Reform. And they're, they're leading advocacy around restorative justice and transforming the system so that it serves survivors. And so I think that is something that, we know that sexual violence is not an individual problem, it's a systemic problem, and to be able to approach healing as a community, and having spaces and places where people can just be. Sometimes we have folks who have finished their counseling, who still just want to come in to the space and be with other survivors, just to check in and to be part of something larger. So I think that's really critical, is supporting those spaces where we can build community, we can build resistance, and form, these advocacy movements where we can actually, build a system that serves our needs.
Thank you. I'm just mindful of history. 1920 was the right to vote for women. And so 105 years later, we're here. And for the timeline of that history, how much we've come. So, it's a huge applaud and recognition to the survivors and the many women, the anti-rape movement, the feminist movement, the social justice that has happened, the advocacy, as Lyndsey's mentioned, the public education, the legal. Like, we're part of a big matrix. And part of that matrix is how much we have transformed and evolved, and we are here, will continue to be. And so in terms of us at TRCC, we also are part of the Ontario Coalition of Rape Crisis Centers, where provincially there's more than 30 rape crisis centers through the Ontario province who are doing collaborative work, the legal systems, putting these conferences together. People come out and learn so much, there's still this taboo thing about sexual violence, domestic violence, but it's not just a single individual issue. It's a major social justice issue going on human rights. Mm-hmm. And so the strategies will continue to be, what do we need to continue to do? I applaud also, those who started this movement many moons ago, because funding has become very precarious in many levels over the last 100 years, and continues to be challenged by, government. And so I applaud the work that is being done on advocacy and lobbying to support survivors and all survivors on continue to strategize on that and the activism that happens. So thank you.
Thank you, everyone. So in the interest of time, I am going to move to audience questions to see if anyone has any questions, and then if not, then we will have a presentation, then break for lunch. And of course, if nobody has questions right now that they want to speak out loud, the resources available are still available at the centers, and I'm sure that anybody would be happy to talk about them if you approach them over lunch, but maybe let them get their lunch first. So we have an online question.
All right, so for the Schlifer Clinic, do you have anyone who could represent or assist a survivor who is being sued by their perpetrator through the anti-SLAPP legislation?
So at the clinic, So at the clinic, we don't provide representation in relation to, any sort of legal action related to sexual assault, and we don't practice in the area of civil law. Having said that, we are more than happy for the individual to contact the clinic, and we have a robust list of lawyers who practice in the community in this area. This would fall under the area of independent legal advice for sexual assault survivors, and we do work with civil lawyers. And so there would be some upfront free legal advice to at least get a sense of, what the issues are, what the strength of the case is, what the risk is, and then, it would be up to the individual to determine if they wanted to retain that lawyer. And of course, there are lawyers in the room who do this work too.
Yes, my boss would be remiss if I didn't mention that I am one of those lawyers.
See, it's a big network. It's a big network. None of us does all of it. Yeah.
Yeah.
Thank you for the question.
Yes, please, Dr. Lawson. We'll get you a microphone, though.
Thank you. I just wanted to comment that you were saying about the history of coming together and advocacy, and how I think that's been so incredibly important, and how grateful I am to the feminist movement over these years that has really advocated for both women and men, right? In all sorts of ways, right? For breaking this. And as a therapist, it was always part of my sense that we had to move through at people's own rate and timing to where the possibility, it was sort of like, who have you told and how did they react? Who do you need to tell, okay? How are you going to forgive yourself? Because I must say, forgiving other people isn't even the question at some point. The pressure to do that is so great, okay, often. And in fact, most people need to undertake, saying, well, it was all right for me to go mail a letter and I got raped or something, or a child, well, I was seductive, or there's all that stuff. And the final thing was the advocacy piece, that moving towards, or the communal piece, moving towards some place, okay, where you were working together in some way, right? However that was. So I think these are all incredibly important things you're talking about, these, okay, this work, okay? So thank you. I just wanted to, sort of, as a therapist, that was really important to work through to that place. Not to pressure to it, but that's getting to the thriving part, I think. Okay. Mm-hmm. Thank you.
Thank you.
Got 2 more questions, looks like.
All right, this is something that it is a conversation we all have, but because there's such an esteemed panel up here, I want to ask you what you do for your self-care working in this very difficult area.
I'll start with Dr. McMann. Cindy, since you didn't get to go first.
Oh, no. Can I pass? Self-care is not my strength, to be totally fair and transparent. But I do have an incredible cat who's very fluffy and very ginger, and I snuggle with him frequently. I do have incredible friends who I can lean on and probably should more. And I also do make a point of having just like a really hot shower every day because I love it and I deserve that. That's about it.
That sounds perfect. So Lyndsey, we'll have you go next.
So I garden a lot. So my whole team sees lots of pictures of my garden all the time. But that's my self-care. I also, and it's really our culture at SASC, like we don't work when we're not working, because this can take over your life. It is, part of our identity to work in this sector, and so it's really important. Danny, my colleague's here, and we were just talking, and I said, I don't respond to emails after 4:30. I'm not on my phone, looking on the weekend or things like that. Like we having really good boundaries in terms of when you're working and not working, because you can burn yourself out so quickly and so deeply. Because many of us are survivors. This is something we're really passionate about, and you can get pulled into where it becomes all-consuming. And so definitely like just having those clear boundaries, and good therapy is also a big plus.
That's a very good question. I think for me, it's a huge challenge to give back the time to say, okay, time to decompress, time to release, time to reflect, how to be able to do this work. And what I've learned over the years through my mentors and Indigenous teachings has been healing is powerful. And thriving through healing is the most amazing spiritual self-love. And so on a daily basis, doing that, reminding myself of the gratitude and the blessings that gathers me to that spirituality, and reminds me that it's okay to be here in this distress, in these challenges. However, we each have a mission and time, to be here. And great bath. My massage therapist was like, gee, put some like white vinegar in there, baking soda, lots of sea salt, aromatherapy there, and just lay there for an hour. And great music, or Netflix, or Prime, or decompressing your own time, and a candle, and incense. And so that has been a ritual where also nature has been, a place to release and be. So bathtubs are like my best friends.
Can I add just a few thoughts?
Yes.
I can very gratefully say that self-care is baked into the culture at the Schlifer Clinic. And I think that sometimes we need our colleagues to remind us and encourage us to actually engage in self-care. And so, for example, we do respect the 9-to-5 workday. Even with our articling students, we do not expect them to work, extra hours and weekends. And we are very vocal about that. And our structure, our organizational structure, is within each department a supervisor. So I am the supervisor of a dozen people, and we schedule regular supervision or check-ins, and it's an opportunity to either just debrief about a recent client exchange that is weighing on them, or it's to talk about a challenge in a case and think through other options, and to really encourage that kind of debriefing and discussions so that we don't carry it all inside and hope that once we go home, we can turn off. We encourage taking vacation time. That's part of my job too, to make sure that staff take their time off and give themselves a chance to, to unwind, and also to even gauge when someone is getting, for example, really drained by a lot of work on a particularly stressful file, to look for ways to give them support and maybe ease off some of the other workload. I think it has to be within the organization as well as our individual sort of attempt to be kind to ourselves.
Thank you. We do have time for one very, very quick question. So I have one more question in the audience, if somebody could assist with bringing a mic over. I believe it's right here. And then we only have truly like a few minutes, so I'm going to choose one person at random to answer the question.
Thank you. I'll be quick. I'll just want to make a comment. I've been a volunteer for the Gatehouse, which is a not-for-profit organization in Toronto since 1998, and they provide emotional support for adult survivors of child sexual abuse. And we found that in our program at the Gatehouse, a big part of the healing journey is for the adult survivor to get support from a family member. So many years ago, besides providing programs for survivors, which is the core of the Gatehouse, they also have workshops, programs for partners of adult survivors. And that's very important because marital or family support is very important as far as healing. And an abused person, often because of the emotional trauma, the stress, anxiety, depression, etc., has problems communicating with people. And if they're living with someone or spending significant time with someone, it's also an important part of the healing journey to have the partner of the survivor be part of the whole process. So it was touched upon by a number of panelists, but I think since the Gatehouse offers many programs, it's in a position that it's able to provide also, amongst other things, programs for partners of survivors. Thank you.
Thank you for your comment. And there are pamphlets about the Gatehouse out on the tables outside. So I'm going to end the panel here. Thank you very much to our panelists once again for everything you have to offer. And then before we break for lunch, there will be a presentation. It's a very brief one, although a very meaningful and important one. So we're very grateful to welcome, or Simona is very excited to introduce them.
First Nations are such an important part of our life in general. In my life specifically, I've been dealing with First Nations clients since 1997, and I think that they are some of the most amazing people out there, and I wish so much that we had treated them better, and I want so much to treat them better. But we have here Stephanie Hill and Heidi Penand from Brantford Region Indigenous Support Center to do a drum song, and they are from the Gehektige First Nation. Thank you.
So, Ani Skano Bijou, my name is Heidi. I originate from Manitoulin Island. Wikwemikong is my reserve. And we work at the Gehektige Friendship Center in Brantford now. So the song I'm singing today is based on the grandmother song. And it's a Cree song, and it's a spirit song of happiness, health, and healing. And I thought it was just perfect for today. So the Asawe Mina Nima means bless us, mother. Ganawe Nima means be with us, mother. So, okay.